fertility tests might be on your mind because you've been trying to conceive and you haven't had much success yet, or because you're wondering about your own fertility for when that time comes. Well, buckle in, you're in the right place to learn about all the different tests that are available for understanding your own fertility. I'm Brooke, I'm an obstetrics and gynecology doctor, and I'm going to use this video to clear up what tests are available to investigate both male and female infertility, and also whether getting your fertility tested is a good idea. Now, trying to conceive can be an incredibly stressful and all-consuming time for any couple. Others around you might be seeming to conceive spontaneously, easily, that may not happen immediately for you. Knowing when you can seek help can help you to feel empowered in your journey. So if your own fertility and that of your partner is normal, there'll be roughly a 25% chance of becoming pregnant each cycle. So that means that most couples don't need any tests to assess their fertility when they start trying, but their chances do depend on the age as well. One study found that couples that are having regular sex at 30 years old, 7 out of 10 of them will conceive within a year. By the age of 35, 6 out of 10 will conceive within a year. By the age of 40, 4 out of 10 will conceive within a year. A really common question to ask is, when should I seek help? When should I ask my doctor for some tests about why I'm not getting pregnant? This is actually common. Around 1 in 7 couples will struggle to fall pregnant. In most situations, even if women know that they've got some element of reduced fertility, like they've got some endometriosis, doctors recommend giving a good chance for natural conception to occur because it can be quite difficult to predict who will and who won't conceive spontaneously. So therefore, giving yourself some time with regular intercourse and tracking your cycle, understanding when you ovulate each month, trying to optimize the chances of getting pregnant is important. So many doctors will prefer you to have been having regular sex without any contraception for at least a year before referring you for fertility tests. If you find you don't conceive spontaneously and you've got no medical problems, you're under 36 years old, you have regular cycles, then you should wait for 12 months and then see your doctor. However, for some people, we recommend seeking help sooner. So make an appointment after 6 months of trying to conceive if either you're over 36 years old, you already know you've got a problem with your fertility, so maybe you're having irregular cycles, you may have PCOS, or you know that you've got, for example, endometriosis. Also, if your partner has a known fertility issue, or if you're just not having periods at all. If you've got any significant concerns about your fertility or your partner's fertility, or you're taking any medication which may affect either the chances of falling pregnant or the safety of a future pregnancy, you should actually see your doctor straight away. So don't even start trying without speaking to your doctor. Now, I've got a separate video with some top tips about how to help yourself to conceive spontaneously if you're trying to fall pregnant. So I'm not going to cover that in this video. What I want to talk about is what you can expect from that first appointment where you're going to talk to your doctor about your fertility. Now, really important, bring your partner with you. What you'll usually start with is a conversation with your doctor, going through your medical history, any pregnancies you might have had in the past, any pregnancies your partner might have had in the past. They might examine you as well. And then they'll talk to you about what tests they're going to arrange. One common test they may be recommending from the beginning is an ultrasound scan. This is usually done as a transvaginal ultrasound scan. It's used to look at your ovaries, your womb, your fallopian tubes. It involves a probe that's inserted through the vagina to get the best view. The scan can give an early indication of anything that might be able to affect your fertility, like if you've got endometriosis or fibroids or ovarian cysts. These scans can be a bit uncomfortable, but they shouldn't be painful. If you've got vaginismus or if you struggle with your smear test, then you should talk to your doctor about what could make that process of the transvaginal ultrasound scan easier. The next set of tests that doctors will probably recommend is some blood tests. Now, hormones are very important for controlling the menstrual cycle, controlling whether or not you're ovulating each month, and also whether that embryo is able to implant. So to understand if there's any hormonal reason that's stopping you from conceiving, your doctor will usually request a set of blood tests. And those will probably include hormones like LH, FSH, estradiol, prolactin, and then potentially thinking about some others like progesterone and testosterone. So the tests are there to help to understand if you're ovulating, and they also can give us an indication if you're not ovulating, why that might be. Usually you'll be told when to get those tests. So they might be recommended for a specific day of your menstrual cycle. For example, the LH and FSH levels, they vary throughout the month, and it's better to get those tests done in the first week of your cycle, so between day 2 and day 5, so that we can compare with roughly what we expect those levels to be at that. If you don't have periods, your periods are very irregular, then ask your doctor when is the best time to have those tests. The commonest condition that affects ovulation is PCOS, polycystic ovarian syndrome, and I've got a separate video about that. And that's where you can see an imbalance of LH and FSH, and sometimes an imbalance of testosterone. There's also disorders of the thyroid gland that can affect your fertility too. Now, progesterone also needs to be measured at a specific time of the cycle in the 3rd week, so around day 21 if you have a regular 28-day cycle. And that hormone can actually tell us if it's likely that last month, if you did ovulate, and that can be a way to confirm whether or not ovulation took place. Now, ovarian reserve tests were developed by IVF clinics to predict how someone having IVF treatment would respond to drugs that are used to stimulate the ovaries and ultimately how many eggs they might produce. But recently, there's been a bit of a trend for women to have their AMH levels checked. Some tests for your fertility might be available privately. This is sometimes suggested to help people to determine if they are fertile or if they should freeze their eggs or not. Now, your ovarian reserve, aka how many eggs remain in your ovaries, can be assessed by measuring 2 important hormones, FSH and LH. And another way to assess ovarian reserve is by ultrasound scan, because during a scan, the follicles in the ovary are counted, and that that will give you a total antral follicle. So what do these tests actually mean? So AMH is a hormone that's produced by the growing follicles, and it's considered a more direct marker of the number of follicles the ovary contains. And your AMH level varies with age and usually falls over time as your ovarian reserve falls. But a normal level is somewhere between 3 and 35. If you've got a lower AMH level, that might indicate a poor ovarian reserve. And higher levels can be associated with someone that's got polycystic ovarian syndrome. AMH level does fluctuate a little bit during the cycle, so it's important to repeat it if there's an unexpected result. But generally, we know that actually age is the best prediction of ovarian reserve. We know that how many follicles you have in your ovary declines over time, and in general, older women, even if they have a good ovarian reserve, are still less likely to do well in IVF, unfortunately, than younger women with a poor ovarian reserve, because it's not just about how many follicles you have, it's also about their quality. Now, it's important to remember that these tests were developed to inform IVF treatment. They're not there to tell you whether you will or won't get pregnant. Many women are told they've got a low AMH level, but they might still conceive without any problems when they actually start actively trying, whilst other people who've got told they have a good ovarian reserve may still take time to fall pregnant and still need fertility treatment. There's no doubt that tests that show a good ovarian reserve is reassuring, but they don't guarantee a baby. And equally, poor or impaired ovarian reserve doesn't definitely mean you're going to need fertility treatment. Having blood tests to check your fertility might tell you something about your ovarian reserve, but it can't be considered a full answer to the question of, am I fertile? And that's because it doesn't assess many of the other factors that affect fertility, like whether the fallopian tubes are blocked, the structure of the uterus, the quality of your partner's sperm. Therefore, it's not generally advised to have these ovarian reserve tests to check your fertility, unless you and your doctor have already determined that you do need some fertility treatment. Now, in that situation, it can be used to predict how you might respond to treatment and also to help to guide the dosing of the medications that you might be given. Next type of test that might be recommended for you is the tubal tests. So, for example, hysterosalpingography, HSG. So an HSG is an X-ray of the uterus and fallopian tubes. This is when you have a special dye inserted into the cavity of the womb, and it shows up on an X-ray screen. We can see that dye filling the uterus and ideally spilling out of the ends of the fallopian tubes, and that indicates that those tubes are open. If the dye doesn't enter the tubes or they don't come out the other side, that might indicate that there's a blockage to the tubes. HSG is actually quite useful in being able to determine where any obstruction is, and also to show the presence of any irregularities in the shape of the cavity of the womb. Another option to check the fallopian tubes is called a Hysteroscopy. So it's similar to an HSG, but instead of using X-rays, it uses ultrasound scan. Fine tube is passed into the cervix, and an ultrasound scan is carried out at the same time. So when the fluid is injected into the tube, the screen, the ultrasound screen, shows the fluid filling the cavity of the uterus before it passes again along the length of each fallopian tube. And the big advantage of Hysteroscopy over HSG is that it's carried out often in an outpatient setting and it doesn't need X-rays, so there's less exposure to radiation. Now, this is a fun fact for you, is that some people who have an HSG or a Hysteroscopy actually say that they fell pregnant quicker after that procedure. As many as 25% of people might fall pregnant in the first 3 months after having this done, and we don't know exactly why it happened, but it may be because the tubes get flushed. So if there was any kind of temporary debris that was blocking the fallopian tubes, that actually gets pushed out of the way, and that can help you to spontaneously fall pregnant. Next up, a laparoscopy. Now, less commonly, if there's significant concerns that could be an issue affecting your fertility, like endometriosis or complications of an infection that you've had in the past, doctors might suggest a keyhole surgery to assess your fertility. So this surgery is known as a laparoscopy, and in that surgery it's also possible to determine if the fallopian tubes are open with a dye test. So a laparoscopy is performed when you're under general anaesthetic, so you're asleep. A tiny incision is made at the lower border of the belly button, and the abdominal cavity is filled with a gas in order to create more space to more accurately view the pelvic organs. And a slim camera called a laparoscope is inserted into that abdominal cavity so that we can visualise the womb and the ovaries and look for pelvic problems like endometriosis or fibroids. We can also inject some dye into the womb through the cervix, and if the tubes are healthy, the dye should be seen to pass along them and then spill out the other side of the tubes. So laparoscopy is good because it allows a direct view of the pelvic organs, and so it permits a much more accurate assessment. It's very good for identifying the presence, for example, of endometriosis, and the majority of people are able to leave home the same day, but it's also a procedure with extra risks, so it's not necessary for everybody. If you do find that you've got some sort of problem that might affect your fertility, a laparoscopy means that surgical treatment can be done at the same time as being able to assess and hopefully improve your fertility. Another procedure that might be recommended is a hysteroscopy. So if there's worries about a structural reason why you aren't falling pregnant, such as fibroids or scar tissue, then your doctor might recommend a hysteroscopy, and that involves putting a camera through the cervix, so going through the vagina into the cervix and looking directly inside the womb, which is distended with some fluid. That procedure can be carried out when you're mildly sedated or even local anaesthetic, or with you fully asleep. Let's not forget that you do need sperm in order to fall pregnant. And so the basic fertility screening test for males or people with a penis is the semen analysis. And in general, the lower the sperm count, the longer it's going to take to fall pregnant. But also important is the sperm quality. And again, it can affect how long it might take or how difficult it is for a pregnancy to occur. Your male partner will be asked to produce a sample by means of masturbation directly into a special sterile container. You got to keep that semen sample warm and bring it to a lab within an hour for testing. Now, after that, the sample volume can be measured, and we also carry out other calculations such as how the sperm move, how fast they move, what percentage have got a normal shape, and things like that. And then you can get given a full report or a semen analysis. It's important to know again with semen that there can be considerable fluctuation in the results between different samples. So if there's any of those parameters that we're worried about, they'll usually be asked to check it by providing a repeat sample. So what next? You've had all these initial tests, and then you should have another appointment with your doctor to go through the results. There's something there that can be easily treated or reversed. Your doctor will probably offer you some treatment there and then see you back after a few more months of trying to conceive. If there hasn't been any clear cause identified for why you're not falling pregnant, or if they have identified something that will clearly prevent you from getting pregnant without further fertility treatment, then they'll usually refer you on to a specialist fertility clinic if you're not already under their care. And that specialist clinic will be able to discuss options, for example, for IVF and other fertility treatment. And it's important to know that fertility treatment doesn't always mean IVF. There's other options like ovulation induction, where you get medications like Clomid or IUI. But again, a fertility specialist can help you understand what is the best option for you. So let me know if there's any of the tests that I've missed out. And should I do a video about what to expect from IVF next? Let me know in the comments below.